when you start to prepare, it's not only from the post-graduation days, it's even after that you need, the preparation continues. So it is actually a mentorship. You become one with the unit that you work with, your senior, your junior, and everybody, your peers. They all work as a unit, and everybody's input is most important. It is to be considered as an expert apprenticeship, because the more you put in a fellowship, the more time, the more effort we put in, the better results we get out of it. We learn every day. It is a mutual learning experience, particularly in a fellowship, and we establish lifelong associations with our peers and teachers, and that's a very good atmosphere to move forward. We need these mentorship programs in India, because we got a lot of postgraduates who are passing out, and a good mentor is the best person you can have in your entire life. And what to expect and how to prepare. First and foremost, your family should allow you, because we are speaking of away from family, that's after your PG. If you're lucky and a bachelor at 28, you don't have to bother about this point, but most of us are married by that time, and again you need to leave your family or take your family with you for this long-term fellowships or short-term, wherever it is. Good thing would be to get your spouse also into some fellowship if she's a doctor. And then the remaining things are basic knowledge, working knowledge of arthroplasty, the patient management, publishing skills, very essential for most of the fellowships, and very good documentation skills. These documentation skills, you need to have a knack for them, because most of and all the fellowships need you to document, and this habit catches on to you, and it is very, very nice to go and review your work every year, every month. It's wonderful. So data keeping is one of the important skills which you need to develop. You need, if you want to buy a new phone, a new iPad, or a new tab to keep your data, that's wonderful. Most of the fellows you see, they will be moving around with their new devices. And why to do a fellowship in arthroplasty? I'm exposed to so many surgeries, so many joint replacement surgeries. We've got 5 units in our college, sir, and most we've seen from primary right up to revisions. And why you have to go and sit for 3 months or 6 months or a year or 2 with some other doctor? And what is there to learn more than what's given in the book? These are the points which we cannot take it for granted, because there are many causes for a joint to become painful. There are umpteen causes, right, from immunological up to mechanical causes. These all causes, unfortunately, the patient thinks that there's only one solution, and a beautiful solution, that's the arthroplasty. This is not the actual truth, because we got a lot of procedures ranging from osteotomies to ligament or cartilage reconstructions, biologicals, physio, and then at the end is where you get and put the replacement inside. So when we do a fellowship, we understand all these points, that a replacement is not a one-stop solution for all joint pains. And this needs to be understood, because we've seen a lot of failures when we do these revision surgeries, when we do the fellowship, done by even very good surgeons or even initiated surgeons, just initiated surgeons. They do find it difficult to manage the complex cases, but unfortunately they end up with these cases in the initial years, and the patients have to undergo costly and painful revision procedures which could have been avoided in the first place if they had good mentorship programs. Arthroplasty is a quality of life changing surgery. It's not an emergency surgery, but definitely patients can get back 20 years of their life and start walking around and moving around. So that's what they want also. So these, when you do these fellowships, we know what is that we can promise to these patients and how to move forward with these procedures. Don't ever sell the procedure is what every mentor tells you. Let the patient ask for it, and we can go forward from there. And you've got umpteen variety of implants available, and a working knowledge of most of the implants is needed. When you do, when you see them operated, when you use them, when you feel the surgeries when they're done, and when you follow up the patients, that's when you understand each implant is for a different category of patients and why they are available in the market. as well as the techniques. Right from the days when it was initiated, it is a joke in most of the fellowships that when they started off with doing their replacement procedures, they would look at the wall tile for a 90-degree angle of the cuts and adjust their cuts accordingly. It's a joke or it's a truth, but then we've started from there. We've gone through a lot of changes using internal jigs, external jigs, and then the computer navigation assisted. And right now we got the robots to do the surgery, assist the surgery. And this is all for precision. See, all these things have evolved through repeated surgeries by the same surgeons, by the teams for improvement. That's what we're doing. We may not start doing robotic surgeries right at the end of your fellowship once you start your clinic, but then we need to understand why and what, when it's needed and how to go about it. A small cap on the short-term and long-term fellowships. Short-term fellowships are good to grasp the basic ideas and to learn how to set up a practice, as well as they are preferred for initiation, or once you've completed a long-term fellowship and you just want to have a brush of what's new, then you can go for a short visitation fellowships. Long-term fellowships, wonderful ones. You learn in-depth knowledge about the arthroplasty, and good patient care improves, and your thought process becomes better, and you can continue as an individual subspecialty surgeon to a large extent. List of orthoplasty fellowships. This is where it gets tricky because for the last month we've been trying to call every listed orthoplasty surgeon and ask if his fellowship is still open, because COVID has come and tossed the entire scenario on its head. Arthroplasty is mainly market driven and market supported, with only a few institutions that are able to provide fellowships throughout the year. So the list is, we shortened the list, but then we have the entire list, which we'll be giving it to you from the participants list. We'll forward it to you. A few of the fellowships of note, and this is the pearl of the eye for every orthoplasty surgeon, the Ranawat's Orthoplasty Fellowship. It's people are selected in a year. It's 3 months. We get to go and work with Ranawat and team in a hospital for special surgeries in New York. Accommodation is provided, and a meager stipend of $750 per month is available. This is the person of contact, Samar Vijay Singh. You can contact him on phone, or you can mail him with 2 letters of recommendation. You need to have a good publication list, as well as you need to have a presentation for their interviews. Next one is a SICOT. Again, it's a world organization, conglomeration of institutes all around the globe. We've got many Indian institutes also with them. Particularly, one is the Hiranandani Orthopedic Fellowship. It's two per year, and they offer accommodation as well as a stipend and a certificate and a diploma degree from SICOT, which is available. Apart from home, we got SICOT traveling fellows all over India as well. These 2 institutions, these 2 groups, that's what we want to say, are good in providing international as well as national exposure for orthopedic surgeons. The ISCSA as well as ISACOS. They promote young talent. They select them through interview as well as based on your CV weightage. And that's a list of number of fellowships that they've provided in 2019. That's all over the globe. And you get a very good perspective. Few are only 2 weeks to 3 weeks, and few are 3-month fellowships. We need to be a member of both associations to be eligible for the fellowships and move forward. Next is the Indian Arthroplasty Association. Again, it gives us the international as well as national fellowships. The criteria would be a member of the association and less than 40 years, working in a center where arthroplasty is being done, or you need to have a good number of arthroplasty surgeries that you have been doing. ISHCS is another North India as well as South India based conglomeration of orthopedic surgeons. They provide fellowships. This is a little bit more structured. You got 6 months of classes, online classes, and then you got to do a cadaver workshop, followed by on-site training in one of the high center hospitals associated with ISHC. South Indian Arthroplasty Academy. It's a 4-center arthroplasty fellowship based in South India. It's from Ganga Hospital, Sparsh, AJRI Chennai, and still a Sunshine Hospital. You get to work 6 months in each hospital. You keep rotating between them, and at the end of it, you get a very good certificate. It's a vast experience. You get to see both primary as well as second revision surgeries, and there is a continuity in the program as you keep rotating amongst them, because you get a monthly review meetings where all 4 centers sit together and they discuss. Very good experience. This is only 2 year. This is the only 2-year fellowship that's available as of now in our country. Ganga Hospital. It's got a lot of fellowships from the Tamil Nadu MGR University Fellowship, as well as the Ganga Hospital's own fellowship and the FNB programs, which they have started recently. The CV needs to be sent to Ganga Hospital. The interview calls are available on the website. Do keep a check on them. And it's a fairly straightforward process. You attend the exam. It's got the basic as well as specialty papers, MCQ questions, and the shortlisted candidates will be called for an interview and selected. Sparsh Hospital in Bangalore, they have got 3 centers throughout the year. They keep operating. They have a good load of joint replacement procedures being done. Person to contact is Dr. Ravi Kumar, and they are present taking 6 fellows per batch, 6 months batch, good stipend, and accommodation is not provided, but they take care of you very well. So the last Sunshine Hospital, the 4th one of these centers in Secunderabad. Now, it was a 6 months program. Now it's become a 12 months program. There were 2 big hospitals. Now they've introduced their robos also. It's a very good experience. You get to see most of the implants in arthroplasty being used there. Good knowledge from Sunshine Hospitals. And the AJRI Chennai, headed by Dr. Suryanarayan and Dr. Vijay Bose. There's a 3 months program, the short visiting program. And Dr. Ashok Kumar is the person you need to contact. They have introduced their robot also, so you get to see everything: conventional, unicompartmental, navigation assisted, and robo assisted surgeries. Moving over to Maharashtra, you got Lord Clinic, one of the pioneers in joint replacements, and their fellowship is for 3 fellows, 6 per 6 months. At present, it's been stopped because they don't have enough load during the COVID season. Dr. Neelan Shah is one more surgeon. He's good practice, but the one thing is you need to keep shifting between the 3 hospitals where he works and operates. Mainly is knee surgeries, and partly hip surgeries also being done. Dr. Sachin Tapasvi, a very well-known name in joint replacements as well as scopy surgeries. He's part of the ISACOS as well as the ISHK fellowships, so you can reach him through those 2 fellowships. Dr. Rajesh Maniyar, again a well-known arthroplasty as well as a deformity correction surgeon. You can contact him on this website. There is a form you need to fill, and then you apply to him in February as well as July. Based on the waiting list, you'll be called for. APOA fellowships, again international fellowships, they're being stopped this year, so we don't get any information about them. You become a member of it, and you start applying for them right after you finish your PG, because they need a publication also along with letters of recommendations. Amrita Hospital, part of the ISACOS fellowship program, they've got fairly enough numbers of trauma, joints as well as scopy. You get to assist most of the surgeries that happen there. Piputri Hospital, this is placed in Bangalore. Dr. Chandrasekhar, they got good number of cases, and the person you can contact, Dr. Chandrasekhar, on his email available on his website. They give good surgeries and exposures. Dr. Krishna Kiran, he works in Hyderabad. He owns a hospital, Medicover. Basically, he's a minimally invasive knee surgeon. Along with, he uses navigation for all his surgeries, and he uses navigation for the hip surgeries also. As of now, it's stopped. The next opening is in June 2021. You can contact him personally on his own email. And our sir, Dr. Subhanam sir, he's running this fellowship since a very long time. And this is one of the best fellowships because it's a 1-year fellowship, and he's got huge load in primary revision as well as unicompartmental, and trauma surgery. So you get to, if you have not done your trauma properly, also you get to do a lot of surgeries. He's there 24/7 with you. It is in his own hospital, so it's one of the best choices as of now available. Thank you. Thanks for bearing with us. I hope it was much informative. Thank you, sir.
Friends, if you have any doubt, you can directly ask, or you can type in the chat box. We'll be happy to answer your queries.
Yes, sir.
Thank you, Vignesh. That was nice presentation, comprehensive. See, the idea of if you want to become an arthroplasty surgeon, you need to make your choices very clear. The spine and hand arthroscopy, they have become a very defined specialty. To become a spine surgeon, you should not do anything else. It's as simple as that. And you should be able to do everything about the spine. Whereas arthroplasty can be an overlapping specialty. You can be a general orthopedic surgeon doing trauma and other things and joints also, or you can be an exclusive arthroplasty surgeon. That you may not be able to decide immediately after your qualification. Okay, it depends upon your interest and choices, opportunities, where you want to settle down, and other so many things. So I would suggest you, and it does take, most of us have trained at least 7-8 years to become an arthroplasty surgeon. So doing 6 months, whether it is here or there, it's not going to make an arthroplasty surgeon. It's going to, you will be aware that do you have an inclination towards arthroplasty or not. That's all you can decide. And I would suggest you take up some of the easily available fellowship, 6 months or a year to start with, and see how you like it. If you like it, if you want to be an exclusive arthroplasty surgeon, then stop everything else, go around another 3-4 years around the world, around everywhere, and then join a team of arthroplasty surgeons. Okay, thanks to the CM scheme in Tamil Nadu, and suddenly it was fairly easy to become an arthroplasty surgeon by technique wise, by availability of cases and patients wise. And I believe that honeymoon is over now, and there's enough centers with the reputation. Just because you are going to do free, you're not going to get big number of cases, what has been the scenario 7-8 years ago. Because of the PM scheme also offers that it's going to be the scenario more and more widening specialties. So go to your regular center, may do it for a year. A lot of fellowships are there. The MGR University Fellowship is there in Preeti Hospital, Devdas Hospital, Ortho 1, and I think there's one in KMCH also. So there's quite a few centers are available, yes, and you go find out whether you got the inclination and it suits your plan. If that's the case, then commit for another 3 years. Okay, or else nothing wrong in doing arthroplasty and then okay, it doesn't really suit me. Let me be a general orthopedic surgeon, or you want to be an arthroscopy and arthroplasty, or whatever you can make a decision. So don't wait too much, too long to get the ideal fellowship. There's nothing like an ideal fellowship. There can be only an ideal candidate. Thank you.
So one question for you.
Yeah.
I think most practiced subspecialty is arthroplasty.
Volume wise,
Volume-wise,
but most growing in US is spine in the last 20 years. Okay. And most subscribed, the defined specialty is spine and arthroscopy. See, our generation is different. We could do everything. And in those days, arthroplasty means generally you'll be doing scopy as well. So that's gone now. Okay, that's because of the CM scheme. Not everybody could. That was that decade everybody could do. I think we are now entering into the next level. That definitely it is. Of course, right from Austin Moore Hemi to the arthroplasty starts. Okay, in your regular trauma practice also, you need to do that. So the volume wise, yes, definitely it is most growing, and definitely the revision number is going to be huge. And there's a big difference between a primary arthroplasty surgeon and a revision surgeon. Unless you do about 30-40 revisions a year, I think it's not fair to do revisions because it is almost a life or death for that particular patient. Something else you want to say?
Any trauma surgeon, so for example, if you take 10 trauma surgeons, at least 5 of them will be doing a joint replacement. So what is practiced in
Tamil Nadu.
Tamil Nadu.
Okay, yes. That is because of the CM scheme. Okay,
so
now it's happening with the PM scheme in other states also, but already existing arthroplasty centers are in Gujarat, Maharashtra, everywhere. Whatever happened in Tamil Nadu 7-8 years ago, it's happening now through the PM scheme. But already established arthroplasty centers are taking it rather than a new spring centers. Okay.
Thank you, sir. So, Vignesh, can you just, there are many people who are asking how to prepare for an arthroplasty entrance.
Thank you, sir. Like you made a few critical points, which is much to be noted. Wonderful. I couldn't make them because being a young surgeon. Thanks, sir. Thanks for making the job very easy. When you want to prepare for an fellowship, again, as sir has said, please do wait for a period of 2 years after your post-graduation because your interest may vary. Your exposure in post-graduation, the place where you want to settle also will vary. And each fellowship, most of the fellowships, they were weighing on your CV. The university granted fellowships have specialty papers wherein you prepare 60% of them would be general orthopedics, and then remaining 40% would be specialty based. That's your arthroplasty section based. Campbell would be fine. You don't have to break your head reading the books. That's the thing. In the UK, you got the MCH programs as well as now we've got FRCS trauma and orth, as well as joint replacement scenarios in Liverpool. They give very good exposure. So that's the UK option which you have. Please do take it to your mind that basic exposure during training is not enough. You need to have the interest to go and learn the fellowship and move forward. I think that's the number of questions. Thank you, Midwest Ortho Society. Yeah.
So regarding this FNP entrance exam for arthroplasty, so previously last year it was a common paper for spine surgery, arthroscopy and arthroplasty. Now they were split into spine and arthroplasty into one group and arthroscopy as a separate group. So there will be 60 questions, 40 questions will be general question, general orthopedics, and 60 questions will be speciality. In that speciality, 30 will be from spine surgery and 30 will be from arthroplasty. So if you are going to appear for arthroplasty, you have to read spine also. So it's a combined paper. So there is no other way. So you have to read both, and you have to go for the counseling after getting the rank.
suppose if you are going to do like a Rothman Institute, sir, how to approach there? Suppose for the young, sir, if someone wants to go to Rothman Institute, Philadelphia, how to approach? Because most of them don't know how to approach the uh, premier institutions in the world.
In this country, we take the fellowship for a basic training and for a pair of hands to run the unit. Okay. But when you go abroad, you should be already committed orthoplasty surgeon. You should have done at least a couple of fellowships in this country. At least you should have 5 publications, out of which 2 should be orthoplasty. When you do at that level, you just send a mail. Whatever the fellowship, just send a mail. Before that, here, like a fresh MS ortho graduate, if you send that mail, definitely you will not be even received. Okay, that should be at the research level, and you should be, as he was mentioning, you should be able to give a presentation why I need a fellowship. So you should have at least 2-3 years of arthroplasty experience after your PG if you want to go for any such this thing, and you should have at least 2-3 clinical presentations in arthroplasty and 1 or 2 research presentations and publications. Now listed journal publication is considered to be very basic. For 3rd year MBBS, my daughter is doing has got 2 listed publications already. Okay, if you go to that level only, it is worth going there for those fellowship. Okay, you can go to Ranavet fellowship. Okay, what are you going to get it? Okay, Dhanasekar Raja went after doing 10,000 cases. He gained. Okay, so at that level only you will be able to gain something by going there. Before that, you should have done at least 3 years of arthroplasty work here, and 10-15 presentations and 4-5 good publications. Then only you are in that league. After that, with that resume, with that reference, you just send a CV. Okay, they know how to pick up a good candidate.
So another question for you, sir. Now we are almost, there are around 400 postgraduates passing out every year.
Tamil Nadu Pandi alone.
We think that Tamil Nadu Orthopedic Association should be more proactive in informing fellowships across the states. So
see, there is
fellowship program. Should the team should also start fellowship program for orthoplasty, spine?
No. The reason is fellowship is being created for so many different reasons. Okay, I have a fellow for 2 things. Okay, I want to train. That's number 2. Number 1 is I want to run my hospital. Simple. Okay, and Depu or Asculap or they want to support, whether it's 15,000 or whatever it is, because they want the aspiring orthoplasty surgeon to be familiar with the product. That's all. It's all business. Without business, you cannot run this thing. So TNOA should conduct exams. Now there is a fellow under me, there is a fellow in the MGR University, there is a fellow of F&B, all those, lot of fellowships are there. 6 months, 2 weeks, traveling and all that. But there is no standardization of their knowledge. I would say speciality evaluation, examination, online examination you can do every 6 months. And you grade accordingly. For primary knee, separately you can have under primary hip, level 1, level 2, level 3. That would be more useful. You may do a fellowship with me and you'll know all what I know. But what I know, what my thoughts are arthroplasty alone is only one area. But what other way of doing it, general this thing. It's not easy to take conventional classes or journal clubs in a regular practicing center unless that candidate is this thing. Okay, so I would suggest that TNOA should conduct the review examination, giving a certification that you are knowledgeable enough. And you can have a level 1, 2, 3 in spine like that. In the primary, in the arthroplasty, they can have a primary, second revision like that. That would be the TNOA's job. Arranging, sponsoring, and the company pudi, that should not be a professional organization job. You should be able to, that happens. Anyway, it happens. It's been already happening. There's enough for this thing. If TNOA comes out with a certification, examination, then the whole India will follow, and that can be improvised this. Now everybody puts a arthroplasty fellowship in their letterpad. Okay, there is no this thing. Yes, they have worked here 6 weeks, there 6 weeks, or attended a course or thing. But what is the certification? What is their knowledge? What is the minimum standard they should have before putting a fellow? It's like an IMA to have a arthroplasty surgeon. You should have additional qualification registered. So TNA should do that sort of evaluate the candidate. Evaluating the center, it's okay. You can only give a broad guidelines. Probably you can start something like that for a spine fellowship evaluation program. Online program. You have 500 MCQs. It's all open. Nothing to secretive about it. Nothing. You're not there to fail somebody. You are there to make sure that they know the basic things. Okay. So when we did the hip replacement course, we did a MCQ, 100 MCQs. They answered before and after the course. Okay. In striker and the ASCLEP lateral course, they do that. Okay. They give you 100 questions on the day one. And the same paper is done after 5 days. They evaluate themselves how they are trained. So TNA can do that, and spine probably you can start, and Midwest can start. Why? we 2-3 people can start an evaluation program and standardize it, give it to TNA.